Good afternoon, everybody. Can I have my presentation? At the very outset, I would like to share that I'm extremely new to the foundation that I'm representing today, and so extremely new to the field of organ donation. In fact, I'm all of 4 months old. Dr. Sunil Shroff, our founder, trustee, and our managing trustee, who was meant to be here, could not make it, and I can assure you I'm going to make a very poor substitute. Having said that, I had a very short presentation because I was told I had about a 15-minute slot. I would still like to use some of those slides now because organ donation is a slightly offbeat issue, and talking about community college in the context of organ donation. We haven't yet started our first course. It will only begin next month, so I do not have experience of having gone through the running a course under the community college, but what I can share is how we arrived at that need. Okay, I'll skip out all these things. The government of India in the year 1994 passed the Transplantation of Human Organs Act, which essentially what it did was it legalized the concept of brain death, thereby facilitating organ procurement from brain death patients. It aimed at stopping commercial dealing of organs, and it defined donor types. That is what it largely did. And under that situation, the Mohan Foundation came into being, and the idea was to increase the scope of the act. We wanted to create public awareness on deceased organ donation, create linkages with hospitals so that more and more hospitals would certify brain deaths, more and more hospitals would hire trained transplant coordinators to carry on the work of organ donation and organ transplantation. We also decided to start training transplant coordinators. I will come to that a little later, and liaise with government in passing favorable legislations. While the act was there, we realized that as we kind of started implementing the work, there was a lot of lacuna, a lot of pitfall within the act. So the Mohan Foundation, along with the government of Tamil Nadu, has helped pass almost 13, 14 government orders which kind of fill in the lacunae of the main act. Okay. We believe, and it is true, that the transplant coordinator is central to the whole process of organ donation and transplantation. He is the main link between the hospital, between the treating doctors, the transplant surgeons, the donor's family, the recipient's family, and in medico-legal cases, which most of accident and brain death cases are, he or she also has to deal with the police and the forensic department. He or she also has to carry out all the legal formalities, take all the necessary consents that are required under the Act. So it's a very important process and a very crucial person in the whole machinery. Having said that, there is an acute shortage of transplant coordinators in the country. There are over 1,000 major hospitals. There are close to 350 transplant centers. And while the Act mandates it that every transplant center has to have a transplant coordinator, there are less than 20 trained transplant coordinators across the country, and that too in the major hospitals like Apollo, Fortis, and one or two more. Why is that? There is a severe lack of training and mentoring facilities when it comes to a transplant coordinator. It is still not, unlike the West, it is still not recognized as a healthcare professional. A transplant coordinator is not looked at a healthcare professional in the current scheme of things. There's a need to popularize the concept of hiring transplant coordinators by transplant hospitals, help them understand that if you're going to be taking either live or deceased organ donation, it is very important to hire a transplant coordinator, and there is no structured training program that is available at this thing. In this situation, I would like to share a case study. The Mohan Foundation entered into a formal agreement with the Rajiv Gandhi Government Hospital in Chennai, and the MOU was signed in 2010. We placed a trained transplant coordinator who had undergone Mohan Foundation training, and we have seen a 70% success rate, which is unparalleled. And nowhere in the rest of the country have we seen this kind of a success rate, where we spoke to 77 families, and almost 50% of them consented to give the organs away. And of course, we retrieved these many organs. We recognize this need pretty early on. There is no training course available in the whole of Asia. The nearest one is in Spain, which needless to say is very expensive. It's unaffordable. And also in the larger scheme of things, it is not relevant to the work that we are doing here. I mean, Spain has a different environment altogether. So it really becomes meaningless in that sense. So in 2009, we started our own certificate and diploma programs ranging from a week to a month, which were aimed at critical care nurses, doctors, social work students, paramedical staff, and other students who were interested in taking this kind of work, and close to 164 participants. Why the community college opportunity? We felt that if we needed to popularize this concept, if we needed to kind of go on a pan-India basis, if we needed to kind of gain acceptability, we needed to get it accredited from a platform like IGNOU. We wanted to make it more accessible because it is a very niche area. It is a very skill-based and very niche area. And we are going to be starting our first diploma course in the next month, a one-year diploma course on transplant coordination and grief counseling. We intend to use the community college for various other niche courses in the area of organ transplantation and all this thing. Things like HLA matching. There are a lot of specialized areas which are not being touched upon in any medical colleges. So we hope to be able to cover some of those areas under this college and look forward to doing this. Thank you so much. Yeah, thank you.